If you've been suffering from symptoms that you have from a concussion for more than 10 to 14 days, or you've been diagnosed with post-concussion syndrome, this video is definitely for you. Hey everyone, Dr. Kevin Leach here. Welcome to the Chiropractic Deep Dive podcast. This is the Upper Cervical Research Show. This is show number 5. So with Dr. Evans, he and I will be going over a paper going over post-concussion syndrome and how the neck is involved and most likely involved with post-concussion syndrome. Okay, welcome back everyone to the Upper Cervical Chiropractic Research Show. This is episode number 5. I'm Dr. Kevin Leach and I'm here once again with Dr. Tyler Evans. How are you, sir?
I'm well. Good to see you again.
Fantastic. All right, so this episode's research review is titled The Role of the Upper Cervical Spine in Post-Concussion Syndrome by Cameron M. Marshall et al., published in the journal the Physician and Sportsmedicine, which is a peer-reviewed journal indexed in PubMed. Dr. Evans, as usual, you want to give us a little overview of the paper and its what it's trying to explain and its goals?
Yes. So this is a amazing paper that was done by, it looks like mostly, I believe they're all medical doctors. And the one that I know of, John Leddy, he is one of the foremost concussion specialists in the country. And he was involved heavily with the NFL studies when all this started to come out with NFL probably, I don't know now, maybe 15 years ago. So he's been involved in the concussion discussion across the country now for a long time. And he was the guy that developed the Buffalo treadmill test, which is one of the kind of foundational heart rate tests for post-concussion work. So I really believe in the upper cervical profession and in the chiropractic world. This is a paper that every chiropractor should know. This is a paper that anyone that deals with concussion patients, they should know this paper. They should know the information in it because it can help you better take care of your patients. And so this paper just starts out by listing some of the statistics about concussion. So mild traumatic brain injury or concussion has an estimated prevalence of about 3.8 million per year. That's 3.8 million people. And in the majority of cases, concussions symptoms resolve within 7 to 10 days. However, in roughly 10 to 15% of the concussion patients, these symptoms prolong and they go longer than a month. And when they do, that's what we call post-concussion syndrome. And that's an important thing because if the symptoms aren't healing, it's really important that we take another look and we change our course of treatment or care to get the patient the best result. And, you know, in our office, and I'm sure in your office, you probably work with other healthcare professionals who deal in this sort of realm. I mean, we work with a guy in our area in the seacoast of New Hampshire that he's one of the leading, he's the leading head neck injury guy in the area. So when a child comes in and they've had a concussion, he checks them out. And so we brought this paper to him. We wanted to make sure he was aware of it because it's important for doctors that are dealing with these patients to know that the neck might actually have a big part to play in these symptoms prolonging and not getting better. And so in this paper, Dr. Leddy and the handful of other doctors here, Cameron Marshall and the other doctors, they go through and really look at, and actually, looking at it now, there's a chiropractor here. So Department of Graduate Studies of Canadian Memorial Chiropractic College, and that's Cameron Marshall. It's got a chiropractic filter that we're looking through this. So when we look at the spine, we look at alignment. If the bones in the spine are out of alignment, it can affect how the body works and the nerves especially. So in this paper, they immediately break down the G's, so the force that is put through the neck when there is a concussion. And when you have a concussion, you have a massive amount of energy and force that's put through the head as well as the neck. And so in this, they outline that, well, roughly 60 to 160 G's is what it takes to get a concussion. That's a lot of force. So I pulled it up right here on Wikipedia, which may not be the best source, but I mean, we're going to be in the ballpark here. An untrained individual not used to the G straining maneuver can black out between 4 and 6 G's if they're in a plane. So like pilots, 4 and 6 G's blacks out a pilot. Okay, so we're talking about 60 to 160 G's of force. So obviously that's going to cause some damage. Well, they always look in the brain, right? If we're having a concussion, we look at the brain. Well, in this paper, they outline maybe the neck is involved. Maybe we should look at the neck. And they talk about examining whiplash-associated disorders. So whenever we talk about whiplash, we're not talking about, whiplash isn't the name of the problem. Whiplash is the name of the way that the problem occurs. So whiplash-associated disorders are what occur after you have a whiplash-type accident. And in a whiplash-type accident, it only takes 4.5 G's to damage or change the ligaments and soft tissue of the neck. And so that's a big red flag for, hey, if you've had a head or neck injury, if you've had a head injury and you've had a concussion, more than likely you have had a whiplash injury as well, a whiplash-associated disorder. And so they're saying, okay, well, if we look at these symptoms, so if you look on the second page of this paper, and if anyone out there needs access to this paper, we can help you find it, because I believe that it is tough to find now online. When I found it initially, it was right there in PubMed. But these symptoms overlap. So when you talk about signs and symptoms of concussion or post-concussion syndrome, and then we talk about signs and symptoms of whiplash-associated disorders, headache, numbness, pressure in the head, headache, they're very similar, numbness and tingling, nausea and dizziness, dizziness and unsteadiness. They're overlapping. So it's really, really hard to suss out unless you're doing a physical exam on a patient and seeing, do they have a problem in their neck? Is there something in the neck that might actually be going on causing these symptoms as well? And obviously the brain is a big part of this, right? So when we have the shearing of the tissue in the brain, we have the cascade of chemicals that then are released in the brain. And that's what we think is part of that, the brain concussion, the tissue that gets injured. But the neck might have a lot to do with this, and a big reason why patients aren't getting well outside of this 30-day criteria. The paper goes on and it talks about the 4 cases that they study. They study 4 cases where they, 5, oh yeah, okay, sorry, yeah, there's 5 cases there. And I believe that in almost all of those cases, they had some sort of neck intervention for some sort of either soft tissue therapy or spinal manipulative therapy, which would be an adjustment from a chiropractor. And the patients did observe a good change in their symptoms. So, it's just a great breakdown on from John Leddy, from this amazing source of information for post-concussion syndrome, that, hey, look, there might be something going on in the neck when this stuff isn't getting better. So, that's what I wanted.
A good, when we think about that 15 to 20 or 10 to 15% of that small percentage of concussion patients that go on to have the PCS or post-concussion syndrome, it's easy to say, well, those are the ones that need to get their neck checked out. But as you just said, 60 to 160 G's of force can cause a concussion. 4 to 6, I think in the paper it says 4.5 G's is as little as they've seen to cause a neck injury. It begs the necessity of actually getting everyone's neck checked who has a concussion, right? That I think that's a huge. I feel like it's, again, with the work that we do with upper cervical chiropractic and working in the craniocervical junction, it's once again it's a missing piece
Mm-hmm.
of the puzzle that should be checked, because even if somebody goes through the concussion and get 100% resolution of symptoms, it doesn't mean they didn't get a neck injury. That's just not creating symptoms now that could create problems in the future. I mean, I'm sure, how many times have you had a patient come in and you say accidents, injuries, car accidents? Nope, nope, nope. You take some x-rays and you see that they've definitely had damage and injury to their spine over time. So, and unfortunately, a lot of these people, they're not told that they need to have their spine checked. And they need to have their spine checked because it creates problems in the future. I always tell people it's the straw that broke the camel's back. They say, oh, well, I haven't had neck pain until 6 months ago and I'm 45. And you look at their neck on their x-ray and you're just like, this has been a problem for decades
Long
now.
time.
And it's the straw that broke the camel's back. So, I mean, this is just one of the mechanisms, a whiplash that people should consider getting their spine and their neck checked for an injury and get it treated accordingly.
Absolutely.
I wrote down a couple just discussion points here. So they put in the paper the definition of PCS, or post-concussion syndrome, is the persistence of 3 or more symptoms for 4 weeks. Now, why does it say 4 weeks when it says that most, or that concussion symptoms should resolve within 10 to 14 days? Why is there a discrepancy there? Do you know anything about that?
Uh, I think that part of the problem is that concussion is such a gray science still. They're still learning, and so if you talk to, uh, this doctor, they might play under these rules of this is what concussion is, or this is what post-concussion is. And I mean, I'm not saying that, we're not we're not agreeing that post-concussion syndrome
Well, it
happens.
makes sense with the
But it's
vast amount of
there's
symptoms that you could possibly have with a concussion, especially when you're dealing with head stuff and dizziness, vertigo, headache, all that kind of stuff. I mean, how many different providers treat those symptoms?
so, and I think a part of the problem too is, I think in our healthcare and in our daily lives anymore, there's a lot more emphasis put on uh, genetics, or the more I was made this way, and so this is just this is how I was made, and so there's no way for me to do anything about this other than through drugs or surgery. And what Dr. Leddy is stepping out in this paper, what he's doing is he's saying, hey, accidents occurring in life may actually affect the spine, and there's been, differences of opinion over the last 100 years as to whether or not the spine can actually even go out of alignment. So, I think John Leddy is probably a little bit ahead of his time in terms of a medical doctor who's putting himself out there and saying like, hey, there may be some good science behind getting the spine worked on in a conservative means to help the brain and the body work better. Right. So I think, I think it's where does your research come from? Where do your studies in PubMed come from? I think it just depends on the source and what their training is, what their background is. And I think Dr. Leddy has a very progressive, more conservative view, and he wants to get the word out there that, if this stuff isn't getting better, go get checked out by a manual therapist, by somebody who's going to work on the spine, work on the muscles, and help that part of the body.
Let's go over the mechanism here. So people might think, let's just connect some dots as far as a cervicogenic, meaning coming from the neck, component too. Like, I mean, that's what the paper is all about. It's proposing, hey, listen, when it's not the brain anymore, it's the neck. And, you know, you could injure the soft tissues in the neck from a whiplash, right? Which would be a whiplash associated disorder. Just real simply, I mean, we're not going to get into anatomy lessons here, but when you think about coming from the neck and how it can be affected, the paper talks about two main ways that an injury to the neck could create these problems: pain related and the other proprioceptive related. So when they talk about a pain related mechanism coming from the neck and neck pain, and we know that pain from the neck can cause headaches. It's called a cervicogenic headache, and we know that those exist, and we see those patients all the time. So that connection is pretty simple there. And then there's the proprioceptive related mechanisms. And for those listening who don't know, proprioception, mechanoreception, these are the mechanisms inside the joint, inside the body, that send signals to the brain, letting it know where the body is. So it's, when we think about that mechanism being involved with dizziness, you can make sense if there's nerves and there's things telling the brain where the body is in space. You know, I tell patients all the time when I talk about this, I just have them close their eyes, and I say, okay, close your eyes, and they're closing their eyes, and I say, okay, do you know where your left hand is? And they say, okay, yeah. Well, how do you know? You're not looking at it, right? So your body's telling your brain where things are.
Right.
And when these proprioceptive mechanisms can be injured or interfered with, that's when you can get that sense of either a dizziness, unbalance, a sense of vertigo, because that communication and that proper communication between your brain and wherever that injured tissue is could be interfered with, which would give you that symptom. And so that's where these neck injuries can be correlated to these symptoms that people are having after that window of concussion into post-concussion syndrome. Any comments on that?
Yeah, so I've sat in actually. So the Cantu Institute, Robert Cantu, he's, in my opinion, he's kind of the other very progressive, very open, conservative research guy for concussion, especially for the NFL. And was right there with John Leddy, I believe, you know, way back, if I'm in the right zone. I believe I am, but Cantu, he puts on once a year, or at least one of the hospitals down there around him in Boston puts on a concussion symposium. And I've gone down to two of them, and it's fascinating because they have a whole hierarchical way that they describe concussion, right? And so, yeah, we've got the neurometabolic cascade and the
which is actually described in, sorry to cut you off, but it's described in figure 1, the whole cascade effect of the concussion and what happens.
Right. So it's an energy mismatch, and that's really why we have fatigue. That's why we have the memory loss. We've got all these weird brain symptoms. But then why do these problems persist? Well, if the patient doesn't get better, well, they break it down and they put it into this hierarchy of, okay, well, how should we treat the patient? Because they want to get results, right? And they see, oh, some of these cases do really great with vestibular therapy. Some of these cases do really well with ocular therapy or special optometric help, either light, lens, different lens colors, different exercises for the eyes, and then the cervicogenic ones, right? So maybe a chiropractic adjustment. Oftentimes this is more in the PT realm, so they're talking about doing PT to the neck, which is great and all. But we're approaching this from a neck situation, right? In this model, the neck can actually drive the eyes, the inner ear, and the brain to have dysfunction. So when we look at the neck, it's a big part of the if you want to call it a three-legged stool, right? So you've got the inner ear, you've got the eyes, and then you've got the cervical spine. The cervical spine drives a lot of input into the brain, into the eyes, into the ear about where things are at in space. And so you can have the trigeminal cervical nucleus driving that input into the brain. That's the largest, the trigeminal cervical nucleus is the largest input for that nerve into the brain, as well as then you can have a vestibular problem, a cervicogenic vestibular problem, because the neck is actually causing the inner ear to be off. Or you can have a what's called an oculocervical reflex, where the neck is causing the eyes to be off, right? And so then you get visual disturbances. You get, I know you probably see it all the time. I see it as well. I work with these therapists that focus on these areas. And if I'm not getting a patient well, what do? I send them to the eye person. I send them to the inner ear person. And between the handful of us, we can get good results. But alone, it's not as great, right? So this is just about getting better results for patients. And we see that the neck is a big component, and it can drive a lot of these other symptoms, as well as a lot of these other problems that are the stool legs for balance and proprioception in the body, in the brain.
Just because we did the hydrodynamics paper recently,
yeah,
thinking about that choking off of the CSF fluid, et cetera.
Mm-hmm.
So when we look at the whole, the cascading effect and the oxidative stress and the neuron imbalancing, ion imbalancing that happens with the concussion, body needs to heal through that for 7 to 14 days. A lot of the people that don't know that the neck could be a contributing factor to these post-concussion symptoms, they talk about how there are 4 mechanisms that they say to try to explain it. And one of them is the continued decrease in ATP and metabolic production. Number 2 is the continued axonal dysfunction. Number 3 is the continued ANS dysfunction, or autonomic nervous system dysfunction. And then the other one is altered blood flow. And it's important to understand that, just as a real quick side note, that when during a concussion, it's mechanical damage, not structural damage to the neurons, right? If we think about, we've talked about this before, mechanical meaning, the ions and things that are functioning, it's not the actual breakdown or damage to the actual nerve, right? So it's not structural, it's more mechanical.
Right.
Anyway, it talks about, as, these, especially that last one, altered blood flow, being a potential ongoing symptom. And we can tie that into the interference of the hydrodynamics of the entire spine from the misalignment, from the injury, meaning that even if it's not an injury to the actual proprioception or the pain reception in the neck that's causing these problems, if there was a misalignment, if that is choking off the CSF flow and the secondary venous outflow and that whole
Arterial.
system, that could lead to an extended period of concussion symptoms as well, which could be also categorized as the post-concussion syndrome. All this is coming full circle. This is all coming full circle to explain these mechanisms, and all of this makes sense to anyone who knows how the body works. And so I hope that this research gets more and more spread out to people, so that we can like you're doing, like I'm doing, so we can co-manage these patients and really find really the mechanism of that individual, and getting everything corrected, doing intervention to get things back to fully functioning in every way, which
Absolutely.
sometimes can be just getting rid of the cause and fixing the injury, and sometimes you need more therapy, like the ocular therapy or the balance therapy or things like that, to try to retrain and rehab the body back to where it should be. So I thought that was a good point to bring up.
Oh yeah, absolutely. That's a great point. And it's, and that's why it's important to understand this literature, especially for doctors. It's patients, yeah, but if other chiropractors, other neurologists. The guy that we work with here in the Seacoast area, he is a osteopath, and he works at a rehab concussion center. And it's like this is top of the crop, good research. Obviously it's not a randomized controlled trial, but I mean there's a great layout here of all the research to look at, and 5 case studies where we saw good changes in symptoms. And it wasn't just one therapy, it was many different things put together, but the neck was a foundational support for it. So
that's what they did in this paper, no, with the five
yeah, that's
with the 5 different patients.
right.
Sometimes it's difficult when 5 or 6 things are done immediately,
Right.
for one thing to really understand what was the problem, but important that they got better with whatever it was. The only thing I think about is time and cost effectiveness of
Totally.
potentially doing all of those things just kind of initially,
Yeah.
when maybe they're not all necessary. However, and you probably agree with me about this, a lot of people will come in, patients will come in, they'll say, okay, what are the percentages or what are the chances that this is going to help?
Mm.
And, I always tell them, I say, listen, I can do an exam for your spine to see if there's an issue with your spine that I can help you with to get your body functioning better. Whether
Absolutely.
that's going to be the factor of correcting the symptom and getting that symptom corrected that you're looking to get corrected, I have no idea. Well, we have to get your spine fixed, give it time, see how much it corrects, and if it doesn't, then we can, try some other things or refer you over here for some therapy, or go that way. I don't know of any exams that can really pinpoint specifically, oh, like you've got headaches. Well, let's do this exam to see if it's related to your spine. I mean, do
Oh,
you
right,
know
right,
it? Do you
right.
see what I'm saying?
Well, yeah, with concussion patients, I mean, we go through the saccades, so vestibular ocular reflex, and you can test vertical and horizontal saccades, and if those are popping up, if you're having convergence insufficiency, if someone's having a pretty positive Romberg's test where they're off to one side real quick. I mean, that's a very quick indicator that, one, they have a brain injury, and 2, their cervical spine is probably not giving good information into their brain, and their inner ear might be a little bit off, and the eyes might be a little bit off too. So then you just start a course of treatment and keep testing and see, okay, is that changing? If it's not, then we can go down a treatment path for that issue, right? So I always tell my patients, give it 4 to 8 weeks. We'll do a re-exam and we'll see where things are at, and then we'll refer out based on how you're feeling and what you would like to accomplish next. But I always say, hey, you got to keep your neck in alignment to continue the momentum, keep the stability of what we've done, because you want to maintain that momentum. But we want to see those neurological tests get better, and we almost always do. So percentage wise, I know that our post-concussion syndrome patients, I mean, they don't get 100% better with us every time, but we see a good, I would say 60 to 70% of people get good results, and then the other 30 to 40%, they need some other therapies, and maybe 10%, they're really affected in some other way, right? And so just keeping their spine in alignment is helpful, but it's not going to be the thing that's going to get, it's not going to get them to home base, right? But it's a big piece of the puzzle. I mean, you're talking about the cervical spine. It's the foundation of the head and the brain, right? So, I mean, it's a big driver. So,
Yeah, awesome. Any other points that you think we've missed with the paper? Anything else to discuss, or any details that we might want to go over?
I think getting imaging for this is really important. I think that, just to reiterate, and we'll probably talk about this on our next video, so check out the next video. Um, but radiographic imaging of some sort, so whether it be X-ray, MRI, or CT or cone beam CT, that sort of information can help you suss out what else is going on here. Is there some whiplash problem that's been going on for a long time, and this has made it worse? And we'll talk about the importance of X-ray in the next video. But for a chiropractor, taking care of someone's spine, measuring the misalignment specifically, and doing a specific correction, especially in the craniocervical junction, where every millimeter counts, every millimeter matters. So getting good imaging, whether it be upright MRI, digital motion X-ray, good upper cervical X-rays, that gives you a better treatment plan, better course of action. So
Yeah. So what would you say if someone's listening to this and they've got, they're suffering with that post-concussion syndrome and they're like, this is me. What's their first step to getting help?
Well, definitely look up an upper cervical chiropractor in your area. You can go to upcspine.com, and then there's a doctor locator or practitioner locator, as well as uppercervicalcare.com. That's the other one, and that has a doctor locator as well. And that'll be a good way to get started. Most upper cervical chiropractors are going to be a good guide and help you find the care that you need, especially those that are involved with NUCA, the Blair organization, Atlas Orthogonal, Advanced Orthogonal, Epic, Knee Chest, Toggle. These are the techniques that you're going to want to look for, and I hope I didn't leave anybody out there.
Well, I was going to say we did a video on a prosthesis of upper cervical, so if whoever's listening didn't see that, then they can go and listen to that, and they can get a better idea of how to find and how to know that you're in an upper cervical chiropractic office.
Yeah, and they're going to be a good guide for you. They'll really help you navigate this. It's a scary thing. I had 3 people this morning that have gotten fantastic results in our office, as well as with some of the referrals that we've given them. And I had a guy this morning that's playing guitar again. It's been 3 years since he got kicked in the head by a kid, because he's an occupational therapist, and he hasn't been able to play guitar. He hasn't been able to play with his kid, and he's playing with his kid again. He's playing guitar. I mean, he brought his son in. His son's laughing and having a good time, and it's like, people get their lives back.
Awesome.
Yeah,
love it.
Yeah.
Any last thoughts, conclusions with the paper here?
No, I think that's good.
Awesome. Well, thank you once again for your time, good sir. Once again, anybody who's listening, drop a like. Likes really help the videos. And if it's helped you, drop a like, drop a comment, subscribe, and all that. The more that you interact with the video, the more people just like you, if you're getting help with this, are going to find the videos as well. So we really appreciate that. That's why we're doing this. We're trying to bring value to the community, to the world, and to people who need this kind of help to change lives, just like you said, Tyler. So great. Thank you for your time, and we'll see you soon.